Hi guys, I think you guys both did a wonderful job. I think it was important to include the warning signs of abuse. So the signs of these are that the child has physical evidence of abuse or neglect, including previous injuries. History is incompatible with the pattern and/or degree of the injury, such as bilateral skull fractures after being dropped. Explanation of how injury occurred is vague, or the parent or guardian is reluctant to provide information. The patient is brought in with a minor, unrelated complaint, and significant trauma is found. Histories are contradictory among the caregivers. The mechanism injury provided is not possible given age or developmental level of the patient, such as a 6-month-old turning on hot water. Bruising or other injury is present in a non-mobile patient. The patient's effect is inappropriate in relation to the extent of injury. The parent, guardian, or custodian disappears after bringing in the patient for trauma, or a patient with suspicious injury is brought in by an unrelated adult. The patient has multiple fractures of differing ages. There was a delay in seeking care for this child, and the parent or caregiver discloses that abuse has or may have occurred. The patient also makes an outcry of abuse or neglect. So these are all very important things that I think we should be looking out for. And you guys did a great job, I think, at explaining this and explaining what page in the book that this all can be found at. I think it's kind of also important to think about the nursing diagnosis that we could possibly have for these kind of children that are having abuse. So, a nursing diagnosis to consider for a child who is maltreated includes fear or anxiety related to negative interpersonal interaction, repeated maltreatment, powerlessness, and potential loss of parents. The expected outcomes includes a child will exhibit minimal fear and anxiety. The child will engage in positive relationships with the caregiver, and child will grieve the loss of the parents. The nursing interventions includes providing consistent caregiver during hospitalization, demonstrate acceptance for that child, praise the child's abilities, treat the child as one with a specific physical problem, not as an abuse victim. Avoid asking too many questions to the child. Use play to communicate. Encourage child to talk about feelings. Provide a private time and place to talk. Help child grieve for loss of parents if parental rights are terminated. Encourage introduction of the foster parents before placement if possible. Offer and encourage food intake at usual times. A question that I have for you guys is, what do you guys think the rate of child abuse is within Metro Detroit? Do you think that it is high? Do you think that it is low? How often do you guys think that maybe child protective services are called in the hospital that you might be, doing your clinical at right now? Just some questions to think about. Thank you again. I think you both did a wonderful job.